Okay, so as I said, guys, wonderful having you here today. What we're going to do is talk all about asthma. My focus is going to be on the winter season. I know we're on the tail end, and today was gorgeous, but we're not quite out of the woods yet. So just to give you tips, not just for this winter, for what's left of it, but moving forward, winter's ahead. And in addition to that, I'm going to kind of dive into asthma basics, what goes on in the lungs, what is asthma, and then at the very end, we're going to talk about some COVID updates. I know it's been a tough year for a lot of us, but thankfully I've got some pretty good news for those of us with asthma, myself included. I also have asthma. So just like I mentioned, kind of already went over this, here's our overview for today. So let's dive in. First question, what is asthma? Let's see. So asthma is a chronic condition. It's actually the leading chronic lung condition among children. So I hope that doesn't worry you. It's not something that you're going to grow out of, but your lungs do grow. There's a variety of severities of asthma, so a wide range. But my hope today is that you start to feel a bit more comfortable controlling your asthma where you're at. So, like I mentioned, we've got a wide variety of severities of asthma, but each one, it can lead to an asthma attack. So let's see what goes on. What is an asthma attack and what happens in those airways? So here I got our handy dandy man with a set of lungs. One side of his lungs here on the left is what's going to look more like a normal lung. And on the right side is what happens to the lung during an asthma attack. So first looking at that normal lung, we're looking at a beautiful airway. Right here, if you see my cursor, is where that air would push through perfectly. It's open. The muscles around the airway are relaxed. We've got a nice, normal, healthy lining and a normal amount of mucus in there. You don't even notice it most of the time. And on the right side here, we're going to point out 1, 2, 3 major processes that happen in someone who has asthma. When they're exposed to a trigger, these are what end up causing those symptoms, what goes on behind the scenes. So let's dive in. 3 things, like I said. First, those tubes are going to swell. So let's back up here for a second. So those tubes, that lining, that beautiful lining that was normal and healthy before, now they're swollen. Almost like when you hit your knee on something, you get that swelling. That's what's going on inside your lungs. It's getting this injury response. It's swelling on the inside. The second thing we see here is mucus production. So that mucus that was just kind of hanging out before, we didn't even notice it, it's growing in excess, kind of in hyperdrive. So that mucus is thick, it's goopy. Maybe when you're coughing, you're even noticing you have a wet cough there, and it's more than we need. So it's causing us some trouble now when it wasn't before. And the third and last major process here is that those muscles that line that airway, we kind of see them in the stripe form here, those muscles are going to start to tighten around that tube. So all 3 of these processes, you can see beautiful open airway, all 3 of these processes are causing that beautiful open airway to grow small, so that air has a harder time pushing through. So our main symptoms that we usually see with an asthma attack, and if we do have some kiddos joining us, you might be super familiar with this, is that cough, that shortness of breath, chest tightness, and some wheezing. This is kind of what's going on behind the scenes right back here, but this is usually what you guys are noticing on the front end. So this is what brings you guys to us often, and this is what an asthma attack looks like from the inside. So what causes an asthma attack? Now we know what happens, but what causes this? Triggers. You might have heard us say this before, but triggers cause an asthma attack. What does that mean? That means that this is a list of the most common triggers that we have. When you're exposed to this, rather when your kids are exposed to some of these triggers, that's when you start having those symptoms. All of a sudden you were fine, and then maybe somebody cut the grass, or maybe you went to a friend's house and they have a cat and you've never been really around a cat before, but now all of a sudden you're coughing, you're starting to wheeze, you're having some tightness. So that's just a basic list of the triggers. My hope is that a lot of you guys are already familiar with the triggers that cause your children an asthma flare-up. But if you're not, that's what I would love to talk about with you. We can certainly arrange an appointment. One part of my jobs is to help to identify what your kids' triggers are, so we can help to control them better. So control, let's talk more about the control here. So how do I end up controlling my kid's asthma? Let's dive in. So medications are a big part of it, not the only part of it, but a big part of it. So if we do have some kiddos out there, and even for the adults, for the parents, uh, I wonder if any of these look familiar to you. We've got some of the common medications here. So let's talk about them a little bit more. There are two main types of asthma treatments. I've sectioned them off here. You're going to see a red rescue inhaler section and the green controller medication section. The red rescue inhaler section is alluding to what's you guys probably know as your Pro Air or your albuterol. These are your medications that oftentimes are literally red, and they're the ones that I want you to run to when you need a rescue. So you're going to hear me say run, red, rescue. All these R words are intentional to try to get you to remember which one is the one you go to when you're in a current asthma attack. When you're having that cough, that wheezing, that shortness of breath, which of these, I got maybe 2, 3 inhalers. Which one do I go to when I'm starting to feel that way? Because I need immediate relief. That's your rescue inhaler. So the great thing about this medication is it works right away within just a couple of minutes. You should be starting to experience some relief. The downside to these medications is that they don't prevent an attack. So they help you in a pinch, but what do you do to prevent these asthma attacks or those flares? That's where we lean into your controller medications. So these are medications that we probably have told you guys before to take every single day. I did talk about earlier that there are different severities of asthma. Some of you may not be on a controller medication, but some of you may very well be. So these are medications, like I said, you take every single day, especially when you're feeling well, because we want to continue to feel well. And their job is to prevent an asthma attack. So when you're in a pinch, when you're feeling those symptoms, don't go grab this guy because he's not going to help you that much. But your red rescue inhaler will. So just as a reminder, red rescue. So the medications, I showed you pictures of the different types of inhalers. What about that spacer thing? What about that tube, that big clunky tube we ask you guys to bring around all the time? Do I really need it? I'm wondering what you guys are thinking. We got somebody on the left with no spacer, somebody on the right here with a spacer. And my hope is, you see, we need that spacer always. So doesn't matter how old you are, even me, I need my spacer. So there are two different types of spacers. We've got one that's got a mask. You see that there on the left, pinches over the nose and the mouth. This one really helps for our younger kiddos that need a little bit of help coordinating their breath. This one's great for typically kiddos under 5. And then on our right, we've got the mouthpiece inhaler. That one is for the older kiddos. So usually 5 years and older, all the way up. It's going to help to mix that medication. You puff that medication, it mixes with the air particles. So more of that medication gets to our lungs. That's what makes those spacers so important. So yes, I hope one of your takeaways today is to remember your spacer. If you need one, you lost it, you don't know where it went, never got one, give us a call. In here, I'm gonna not play these videos, but these are my go-to videos. If you've been in an appointment with me, I send you these links constantly. I'm a Boston girl, grew up New England, worked at Boston Children's Hospital for a bit there. So these are my go-to videos for you guys. I'll have these in this PowerPoint. The PowerPoint will be uploaded after today to our website for you to access these videos if you haven't seen them before. So I've got one for a recap on how to use your inhaler with your face mask, if you've got the face mask, and with the mouthpiece. Great reminders, just a couple minutes long. I recommend them for everybody. Moving along, guys, we're cruising here. Next section here is the Mythbusters section. So this might be where we have some fun. So they're specifically about inhaled steroids, so those daily controller medications. We're gonna go through myths versus facts, some common myths I've heard a lot of in the office. So first one's up. Are these the same steroids that athletes take? The bodybuilders that they use to build their muscle mass? Because I don't know how I feel about that. Shares the same word, right? It's a myth. So you may already be familiar, but these are corticosteroids, not anabolic steroids. So they're completely different. thankfully, unless you were hoping to bulk up. But unfortunately, it's not going to happen with these guys. So the good news is that they therefore don't share any of those negative side effects that the anabolic steroids do, the ones that you hear about in the news. These steroids are much better for you, especially for your airways. Next myth, inhaled steroids. I've heard they can stunt my kids' growth. It's part of the reason why I'm not so sure about them. Can they stunt my kids' growth? That's also a myth. So many of the side effects, I'm going to differentiate a little bit because some of you may have actually had two different types of steroids. We've got the inhaled steroids, which are your daily medications. Then you got the oral steroids. So maybe some of you have really been in a tough asthma attack where your medications just weren't working for you, and we needed to prescribe you an oral steroid like prednisone or prednisolone, if those sound familiar to you. Those are the heavy hitters. Those are the ones that we really don't want to use unless we have to. So those are really potent. And actually, I got a fun fact in there that a 5-day course of that liquid or oral steroid medication, the prednisone or prednisolone, is the same amount of medication as what you could get from your inhaled controller medication over a year. So our inhaled controller medications, guys, they're very small doses, a small maintenance dose to keep you nice and healthy. We really want you to use those so we don't have to use the prednisone or the prednisolone. We will if we have to. They're great medication, but they are potent, okay? The one side effect that I do want to bring your attention to is thrush. So if you may already be familiar with it, it's this white coating that can happen on the tongue or on the gums. And this can happen if you don't rinse your mouth out after using your steroid medication. So you may have heard us say, I hope you have, that with your daily medications, I want you guys to drink a glass of water afterwards or rinse your mouth out and spit, because that will help. That's all you need to do to clear that medication out of your mouth so you don't get that. But if you do see those symptoms, you can always give us a call. Next myth buster here. Daily medications are addictive and dangerous. We do take them every day after all. So is it addictive? No, it's not. Thankfully, although you take them every day, they are considered safe and effective. So there's our umpire calling it safe. Last one here. I may have dropped a hint earlier if you were paying attention, but I'm feeling fine right now. Can I stop my daily controller medication? What do we think? That's also a myth. I really, really, really want you guys, if you've been prescribed a daily medication, a controller medication, to keep using them, especially when you're feeling well. Again, that for me is a sign that they're doing their job. So if you were to stop them prematurely, there is a chance that it could lead to an asthma flare-up and attack, which is what we want to avoid. But if you've been well controlled for a while, talk to us. Well, part of the reason for my diagram there is that with asthma, like I said, we've got a variety of severities here. My job as the asthma educator is to always be asking every time I see you, do we need to step up on your medication? Do we need to increase it? Or can we step down? Can we use less medication to keep you controlled? That's my goal, always. Less medication to keep you controlled, the better. So if you've been on a straight and narrow path where you haven't been having symptoms and you're on that controller medication, don't stop it without talking to us. We can advise you. We'll drop you down if we can. It's always our goal. All right, guys, moving right along. Next section here is specific to the winter. So how does the winter affect my asthma? Back to the trigger slide. This slide, I've pulled out the triggers that we see most common triggering flaring up our asthma in the wintertime. So we got mold, dust, bacterial, viral infections, cold air. I hear about these ones all winter long, so I really wanted to bring them to your attention today, just in case this resonates with you. So let's talk about what we can do about them. First, I would like to point out is that asthma is the third ranking cause of hospitalizations among children younger than 15 years old. So part of the reason why it's so important for me to get across to you guys, what are your kids' triggers? What can we do about them? We want to keep you guys out of the ERs. If we're keeping you out of the ER, we're doing our job. So this is a really big reason, a big push for these classes. God bless you. A big reason for these classes, a big reason for us to educate you guys as much as we can, is to really keep you guys and your kiddos well and healthy and out of the ERs. So, number one, in the cold, layer up. Keep warm. Like I said, cold air can be a trigger. So that looks like wearing a scarf, wrapping it around your head, covering your mouth, wearing a face mask, which we are using a lot of these days, can kind of multi-purpose it, even for those of us that maybe aren't triggered by the cold. You've felt that warmth, maybe putting on your face mask. You had the opportunity to take it off, but you left it on because it kept that air nice and warm in there. That's great because you're warming up that air before your lungs have to. So that cold air can trigger an asthma response, but if you keep that air nice and warm from the outside, you do the job for your lungs, which will ultimately help. So keep yourself warm out there. Whoop. Christmas story, if you get that reference. Number two is don't forget the indoors. Although it's cold out there, all of a sudden we're keeping all of our windows closed and maybe collecting more dust than we used to. So make sure to wash those linens. I want you to wash those sheets in hot water and vacuum your house if you can, ideally once a week. That stuff accumulates fast. By that stuff, I mean dust. So I also tell people not to use ceiling fans. Try not to use fans in general in the wintertime because all that does, it doesn't purify. It just what it does, it takes that dust off that surface, whether it be a desktop, countertop, dresser, and it's going to take that dust and launch it into the air. I see fans all the time causing us some trouble. So vacuum it up, collect that dust, reduce those allergens inside as a way to improve the air quality. And then just to remind you guys to continue your asthma medication. So you might be like, all right, Marina, I get it. We said this over and over, but I hope that's part of my goal for you today. Remember your asthma medications, what you've been prescribed, carry your inhaler, use your controller meds, stay on top of it. It will help to prevent these issues. So even if you're exposed to these triggers, even if you do have a little bit more dust in home, even if it is a little bit cold outside, but you've got friends playing out there, throwing some snowballs around, you don't have to feel limited by your asthma. My goal is that you can do everything that your friends are doing. It doesn't hold you back. So that's what our controller meds are for. And then prevent. Let's seek to prevent. Don't wait to vaccinate. I know we're still waiting on the COVID vaccine for kiddos. Hasn't been approved, but we still have our flu shots. So do want to recommend you guys to get your flu shots if you haven't. I know because we've mentioned viral illness can be a trigger for a lot of folks. Flu is a viral illness. So let's vaccinate against what we can, and then keep up on that great hand washing. I know we're doing a lot of that this past year. Keep it going. That's another way to keep you nice and healthy. And wear those masks. And then be prepared. Are you due for an asthma check? Make sure that you're talking with your provider at your well checks. When's my next asthma check? Try to be proactive. Rather than coming in just for your coughs and wheezes, let's try to see you for when you're feeling well. Make sure your medications are working well. Make sure you're using them right. We can assess whether we need to step up, step down, and please come with questions. I love questions in my clinic, and we'll be getting to your questions here soon. So really, like I said, part of our jobs is to make you guys asthma educators at home, so you can feel in charge and in control of caring for your kids' asthma, and then one day that they can be in charge of their own asthma too. So there's my name, just in case you missed it in the beginning. Again, my name is Marina McBee, nurse practitioner, asthma educator, speaking both English and Spanish. Happy to meet with you guys. All right, last section, guys. If you're getting a little asthma fatigue, this is the last part. So here are our COVID updates. And like I said in the very beginning, they're very encouraging. And they have been really persistently since I've been following them since it started, when we started getting data back in about September timeframe. So I've got some great news for you guys here. Let's walk through it. So first quote here is, although all ages can be affected, COVID-19 infection has lower clinical impact on children and adolescents than on adults. So great, we already know that. As far as kiddos, many of you may already know that, with kiddos being less affected by COVID in general. Great news. There are also studies that suggest that kiddos with asthma do not appear disproportionately more affected by this virus than the kiddos that do not have asthma. Very encouraging. So just because you have asthma does not mean you're at increased risk of severe illness or illness in general from COVID-19. And this one, it actually says the exact same thing, but it was a different study. So I've got the studies here listed. And then I wanted to point out that this one was back from September 2020. So I'm going to flip back my slide for a second. This one's from September. This one's from January of this year. Oops, my apologies. Oh, I'm going the wrong way. Sneak peek. September 2020, and then this one's January of this year, and it's the same. So we've gathered months of research and data, and we're still seeing the same thing. Super, super, super encouraging that kiddos with asthma are not more affected by this virus, even though it's a viral illness and we're talking about the airways. It's amazing. It's really, really, really encouraging. This one, I'll read to you here. A study of 1,526 patients from the US reported that 14% of patients with COVID-19 had asthma, but the presence of asthma and the use of the inhaled steroids were not found to be a risk factor for hospitalization. So some of you may have read that steroids can lower your immune system. That may be true, but not the inhaled steroids. So as we mentioned back in the beginning, inhaled steroids are really small doses. So it's not the same as somebody else who may be on a higher dose of steroid or need regular steroid therapy. We're not talking about the same thing. So just because you're on your controller medication does not mean that you should stop it because you're worried that it's going to lead to a lower immune system. Not the case. The data is showing otherwise. So keep up those controller meds. Here we have asthma and allergic diseases do not appear to be risk factors for hospitalization due to COVID in children. And having a pet at home can be a protective effect. Thought that was pretty darn cute. For those of you that have pets at home, there's my 9-month-old golden retriever in the bottom left-hand corner. But kind of the same information here, but now talking about this one, this particular study looked at hospitalizations. So are we seeing more kiddos with asthma ending up in the hospital? The answer is no. The kiddos with asthma. The proposed hypothesis for a relative decrease of COVID-19 prevalence in asthmatic patients are self-protection awareness. So just to kind of simplify that down a little bit. So why, how, why is it that a respiratory virus in an asthma kiddo, why are we not seeing this affect them more than the other kiddos? So this is what we're starting to hypothesize here as of this past January. It's coming down to self-protection awareness, regular intake of asthma medication during the pandemic. So we've really seen people stay on top of their meds, markedly reduced levels of ACE2 expression in atopic individuals, which kind of talks about more the biological side, and inhaled steroid treatment. So staying on top of your daily controller medications. So part of that self-protection awareness, I know a lot of you maybe are like, well, I know you didn't do a great job on my meds, but we haven't seen anybody. So that's part of the self-protection awareness too. I hope you stay with your meds, but there are a number of things that roll into that. So this is, again, just really encouraging. I think we're getting close to the last ones here, but focus on asthma control, risk stratisfaction, and medication adherence will be essential to allow children with asthma to return safely to school. So I know as we're starting to think, I'm kind of taking you through the timeline here of this data. Great information on the front end. How are we doing that? How are we keeping kids out of the hospital? Why is it that they're well controlled? Well, it seems like they're taking their medications. They're staying on top of what they can control, masks, hand washing. Well, then how do we get back to school? We're talking about medications now, staying on top of your medications, controlling what you can control, just like we've been talking about throughout all these slides. That'll be essential because we want to get back to school. We really do. And children and adolescents with asthma do not appear to need any additional prophylactic measures from COVID-19 when asthma is well treated. So we've gotten some calls. Because of COVID, do I need to double my dose? Do I need to step up therapy? Do I need to do more? Do I need to do anything to prevent the asthma attacks? And the answer is no. Just stay on the regimen that you've always been on. Keep that going, and that will continue to control your asthma. Children and young people with asthma need regular monitoring to maintain good asthma control, prevent asthma attacks, and manage comorbidities. So because of that, regular monitoring, telemedicine can play an exciting role in the management of childhood asthma by delivering high quality care closer to the child's home. So this is a study that looked at the effects of telemedicine, especially with asthma. I'm really excited about it because I've done a lot of my virtual checks now, uh, asthma management, telemedicine visits, and they've gone so well. You guys love being at home. It keeps you home, keeps you safe, and I get to also see all your medications. You got them right there. So if you forget to bring them to the clinic sometimes, it doesn't matter. If you're at home, it's worked really well, that component. So I encourage you guys to see the value in the telemedicine visits. I know we'd love to have you in the office, but they're still valuable, especially when it comes to asthma management. So our breakdown, what are our suggestions here? Kind of our key takeaways. Continue your medications, especially those controllers. Make sure they're not expired. If you need refills, give us a call. Avoid those triggers. So when you, all that list that we brought you through, this is the non-medication way to help with your child's asthma, is to really avoid or limit those triggers that we know cause problems and keep up with those asthma checks. So that's what we're here for. All right, guys, that brings us to the